Welcome back, Deep Divers. Today, we're diving into something, maybe not the most pleasant topic,
Okay.
but every dog owner out there has dealt with it at some point. We're talking canine diarrhea.
Yeah, that's right. And as much as we hate those messy situations, knowing the reasons behind diarrhea can make a huge difference in getting your furry friend the right care.
Absolutely. Going through this veterinary document you sent, I was actually surprised to learn there are over 15 different things that can cause diarrhea in dogs. We're looking at parasites, food allergies,
Right.
even stress.
It's amazing, isn't it? It really shows how important a proper vet diagnosis is. Instead of guessing, we need to find the root cause to really tackle the problem.
That makes sense. So how do we, as dog owners, know when it's more than just a little tummy trouble? What signs should we be looking out for?
Well, obviously, loose and watery stool is a giveaway, but there are other changes in your dog's behavior that can be a heads up. For example, tenesmus.
Tenesmus?
Yeah, basically straining to poop
Oh, okay.
can actually indicate something more serious is going on.
Huh. Straining. Wouldn't have thought to connect that with diarrhea?
Right. It often means discomfort or even pain when they're trying to go, which definitely needs a closer look. And, beyond just their bathroom habits, keep an eye out for anything unusual, like their energy, appetite, or if they're suddenly drinking more or less water.
Speaking of getting your dog to the vet, what about the logistics of that? Getting a dog with an upset stomach into the car, that can be an adventure in itself.
Tell me about it.
So what's the best way to handle that?
Luckily, the document had some good advice on this. Ideally, using a carrier or a crate is your best bet. Safest for everyone and keeps the mess contained.
True. But what about for those of us with big dogs? Like the ones who barely fit through the door, let alone in a crate.
Well, in those cases, waterproof seat covers or a dog hammock can be lifesavers. Or even just putting down some old towels or blankets can save your car from disaster.
Great advice. So let's say you've managed to get your pup to the vet. What happens in that exam room? The document had a surprising amount of detail about how the vet figures out what's wrong.
It's like a peek into their thought process, right? It usually starts with a thorough history. The vet's going to ask tons of questions about your dog's symptoms. Like when the diarrhea started, how often they're going, what the poop actually looks like. And they want to know if there are other symptoms too, like vomiting, or if your dog seems more tired than usual.
Right.
They'll also ask about their diet, anything new in their environment, if they could have eaten something they shouldn't have, that kind of thing.
Sounds like a bit of detective work.
It really is. They're putting together all the clues to get the full picture.
Okay.
And after that comes the physical exam, where the vet actually gets hands-on.
Let's break that down a bit.
Yeah.
What are they looking for during the physical exam?
So they'll check your dog's overall appearance, how they're behaving, and how hydrated they are. Checking their gums is a big one. Dry or sticky gums, or if they look pale, that can be a clear sign of dehydration, which is a big worry with diarrhea. They'll also listen to their heart and lungs, feel their belly to see if there's any pain or anything feels out of place. It's about getting a good sense of their overall physical condition.
Yeah, it's amazing what vets can tell just by looking and listening.
Yeah.
But the investigation doesn't stop there, right? They have those diagnostic tests, too.
That's right. Based on what they find from the questions and the physical exam, the vet might suggest a few different tests to get a better idea of what's going on.
Like what? What kind of tests are we talking about?
Well, a fecal exam is pretty standard. Helps rule out parasites. Those little guys can really mess up a dog's digestion.
Right, those microscopic troublemakers. I've definitely heard those horror stories.
Oh, yeah. We're talking roundworms, hookworms, Giardia, those sorts of things.
Okay, so if they do find parasites, then what?
Usually it's antiparasitic meds. They're pretty effective at getting rid of those unwanted guests.
Makes sense.
But you got to follow the vet's instructions to the letter. Dosage, how long to give the medication. That's important.
Yeah, you don't want to give those parasites a chance to make a comeback. What if it's not parasites? What other tests might they do?
If the vet thinks it could be a bacterial or viral infection, they might want to do some blood work. A blood test can tell you a lot about what's going on inside. Infections, inflammation, even other problems like pancreatitis or liver disease that could be causing the runs.
Like a window into their insides.
Exactly. And for puppies or younger dogs, they might also test for parvovirus.
Parvovirus, that one always sounds scary. What is it about parvo that makes it so dangerous?
Parvovirus is a virus, it's highly contagious, and it attacks their intestines. Leads to really bad vomiting and diarrhea. And it's really dangerous for puppies because their immune systems are still developing.
Oh, wow.
The good news is it's largely preventable with vaccines. Those puppy shots are so important for that reason.
Yeah, good reminder for all the new puppy parents out there. Stay up to date on those shots. So we've covered blood work, fecal tests.
Uh-huh.
What about imaging? Do vets ever use x-rays or ultrasounds to diagnose diarrhea?
Yeah, they do, mostly when they think it could be something more serious, like a blockage.
I see.
If there's a chance your dog swallowed something they shouldn't have, or if there are other symptoms that are worrying, imaging can help them see what's going on in the digestive tract and check for any blockages or problems.
Okay, so the vet's done the tests. They've figured out what's causing the diarrhea. What happens next?
Time to make a treatment plan, which obviously depends on what's causing the problem in the first place.
Of course. So let's say it's something simple, like maybe my dog got into the trash and ate something they weren't supposed to. It's a bit of a tummy upset.
In those less serious situations, the vet might recommend a bland diet for a few days. Give their system a chance to rest and reset. Boiled chicken and rice is a classic.
The old chicken and rice remedy. Is there a reason that's so often recommended?
It's bland, easy to digest, which is exactly what you want when their stomach is upset. They might also suggest a special gastrointestinal diet, the kind you can buy at the pet store, that's designed to be easy on their tummy.
So just giving their digestive system a break with food that's gentle and easy to process? What about when it's more than just an upset stomach? Say it's a bacterial infection.
In those cases, they'll probably prescribe antibiotics to take care of the bacteria.
Makes sense. And what about dehydration? We've talked about that being a concern with diarrhea. How do vets usually handle that?
You're right, dehydration is a big worry because they lose fluids and electrolytes with diarrhea. If your dog is showing signs of dehydration, remember those dry, sticky gums, the vet might give them fluids, either under the skin or through an IV. Depends on how dehydrated they are.
So basically replacing the fluids they've lost.
Yeah.
Makes sense. So everything's going well, the treatment's working. How long does it usually take for a dog to recover from diarrhea?
That's the million-dollar question, isn't it? And there's no easy answer. It really depends on what caused it and how bad it is. For mild cases, like a simple upset tummy, it might only be a couple of days with a little TLC.
Oh, that's good to hear. Just a quick blip on the radar.
Right. But for something like a parasitic infection, it might be a bit longer, maybe 5 to 7 days once they start the medication.
Okay.
And even if they seem better, they could still be shedding those parasites in their poop. So you've got to be super careful about hygiene and follow the vet's instructions about follow-up fecal tests.
We'll celebrate too early.
Exactly.
What about the more serious stuff, like that parvovirus we talked about?
Those can take a lot longer, unfortunately, sometimes weeks, maybe even months, depending on how sick they get. And even once they're better, they might need extra care and monitoring.
Sounds like those situations can be rough for both the dog and the owner.
They definitely can be. And that brings us to something really important that all dog owners should know. When is diarrhea more than just an inconvenience? When is it a real emergency?
That's a great question because I was just about to ask you about that. The document mentioned how serious untreated diarrhea can be.
Mm-hmm.
And it really made me realize how important it is to know when it's time to call the vet right away.
Mm-hmm.
So what are those red flags? What are the signs that things are getting worse and it's time to worry?
Yeah.
So we've talked about dehydration. What other warning signs should we be watching for?
Blood in the stool is a big one. Like a little bit of streaking, that might not be an immediate panic situation.
Right.
But if it's consistently bloody, that's definitely a sign to call the vet. Could be inflammation, infection, even damage to the intestinal lining.
Yeah, you don't want to mess around with that.
Yeah. Another thing is lethargy. And I don't mean just a little sleepy after a walk. I mean a real change in their energy. If they seem really tired, weak, not like themselves.
Yeah.
And especially if they're not eating or drinking either. That's a clear sign something's wrong.
So it's not just one symptom, it's looking at the whole picture.
Exactly. It's about connecting the dots. Think about their overall demeanor, how much energy they have, any other symptoms like vomiting or fever if they seem to be having tummy pain.
And in those situations, even if it's just a gut feeling,
Yeah,
better safe is, get in touch with your vet.
absolutely. Don't wait if you're concerned. Catching it early can make all the difference.
This has been such a great deep dive. Learned so much about something that, let's be real, isn't the most fun topic.
Not the most glamorous, that's for sure, but important.
Definitely. I think the biggest thing I'm taking away from this is how important it is to really pay attention to our dogs. They can't exactly tell us when they're not feeling well. So it's up to us to notice those little signs, those subtle hints that something's off.
I couldn't agree more. And you know your dog better than anyone. Trust your gut. If something seems wrong, even if you can't put your finger on it, it's always a good idea to at least chat with your vet.
Great advice. Well, deep divers, that wraps up our deep dive into canine diarrhea. Hopefully you learned a thing or two and feel a little more prepared to tackle those messy moments should they happen.
Remember, a little knowledge goes a long way when it comes to keeping our furry friends happy and healthy.
Couldn't have said it better myself.
Yeah.
Don't forget to subscribe to the deep dive so you don't miss our next adventure. Until then, happy tail wags to all.